Obviously, the state had concerns about not creating hysteria. I had concerns about my workforce, who knew enough about COVID to know that it was dangerous, and it was dangerous for the people that came into contact with people that had it. We didn't have any answers at the time. We thought maybe we'd be out of this in 6 weeks.
Yeah.
And, most healthcare facilities, I would say all healthcare professionals, they can weather a storm.
Sure.
This was not a storm. This wasn't a hurricane. This wasn't a flood. This was years of an onslaught of an illness that was very communicable and had bad outcomes. One of the biggest responsibilities our team felt was, how do we create resiliency in our staff, not knowing when this was going to end.
Welcome to Prevention Pioneers. I'm your host, Mike Holloway, and today I have the honor of welcoming our guest, Jack Lynch, former president and CEO of Mainline Health. Jack just retired after a 20-year career at Mainline Health, and today we're here to talk to Jack about leading through chaos. Well, welcome, Jack. Thanks for joining Prevention Pioneers. Really appreciate it.
Thanks. Great to be here. I didn't realize I was a pioneer, but I'm thrilled to be a part of this program.
Well, I view you as a pioneer. I haven't watched you lead for the last 20 years, and watching what you've meant to Mainline Health in our community has certainly been a very, very big blessing for us. So thank you.
Well, thank you.
How's retirement been?
It's good. It's an adjustment. I have 41 years I was in the field, 20 at Mainline Health, and my oxygen is people. So I'm trying to figure out where I'm going to get my oxygen over the next period of time, the next chapter. Yeah. Spending time with family and friends, and but still staying connected to healthcare, because there's a couple things I'm really passionate about.
No, that's great. That's great. And today we're here to really talk about a key piece of healthcare that I think goes a lot broader than most people think, right? The word prevention. Let's talk about prevention. I don't think people who are outside of the everyday life of healthcare really understand the importance of that word. Can you just elaborate on the importance of prevention to healthcare overall?
Yeah, I would say that as a leader in healthcare, I understood the benefits of prevention, whether it's the benefits of preventing disease or preventing illness. But when you think about it, anybody in the workplace, anybody in a family should be very interested and concerned about prevention. How do I prevent myself from stressing out? How do I prevent myself from getting sick? How do I prevent myself from getting the flu? So there are really scientific, evidence-based things you can do to prevent certain things from happening.
A lot of people don't understand that ripple effect, right? The ripple effect of, if I don't prevent and I get into that acute setting, the impact on the social environment of the person, the family experiences that individual has, relationship-wise, but also the ripple effect of cost to an organization, right? So you're constantly hearing the word today, prevention, prevention, prevention. And that's why I'm excited to be here today to talk to you. And I think that word really applies to what our topic today is, which is leading through chaos. And I think if we could all leave here today with just a couple of hot tips from Jack Lynch over his 39 years of experience in healthcare, but 20 at Mainline Health, and really leading through chaos, especially through some really hectic times. COVID-19 probably being top of them all. I think we'll all be really well off. So
one of the things I want to make sure I don't come across is thinking about this just from a financial standpoint.
Sure.
One would say, well, why is a hospital concerned about prevention? You need to fill your beds. We're underbedded in this community.
Yeah.
So preventing people from getting sick is good for healthcare. And I would say that most of the healthcare providers in America are interested in a healthier community. So again, getting back to your word, prevention, in order to have a healthier community, prevention is a key part of it.
Yeah, and I that's a wonderful point. I don't think a lot of people understand the stresses that hospitals have, right? I think people think, well, hospitals are full, that's a great thing, right? There's that kind of balance of where hospitals need to be at. But then there's also the aspect of how many people hospitals treat that aren't being reimbursed for that treatment. Right. So it's a crazy balance that I think is really hard to understand, and that word prevention fits really nicely into that.
And you really can't talk about healthcare and, quite frankly, even prevention without talking about the workforce. And a healthy workforce is how we all get our jobs done.
Yeah.
And without that healthy workforce, it's difficult to meet the needs of whatever your mission is.
Yeah. Let's start there with the workforce. So November, December 2019 comes through. We're starting to hear about this COVID-19 epidemic, and all of a sudden, March 2020 rolls around. The schools are shut down. Nobody knows what to do. And all of a sudden, the music stops. People are working from home. Schools are being taught virtually if they can do it. Virtually everybody stops working and goes to a remote workforce, but not the hospital system, right?
I was going to say, where did the music stop?
Yeah,
Didn't
the
stop
music
for us.
didn't stop in the healthcare system, and I think that is something that I'd love to talk about today. As a leader, leading through that, knowing that you're watching the entire world shut down, but you have thousands of employees that you count on every day showing up for work. How do you lead through that?
You know, it's a great question. And I was down in Florida, actually, at the Phillies spring training camp when I got the first call that Paoli Hospital had a patient that they suspected might have COVID. And we got into a discussion with the county and the state and the health commissioner about how much information we were going to release about this particular patient and what he had. And my philosophy is you be transparent, because you're going to get yourself in trouble if you're not transparent. Obviously, the state had concerns about not creating hysteria. I had concerns about my workforce, who knew enough about COVID to know that it was dangerous, and it was dangerous for the people that came into contact with people that had it. Sure. We didn't have any answers at the time. And so that was my first experience. When I got back in town, we had started to see more patients, and really needed to focus on keeping our workforce safe. And this really came about, we used to have a huge initiative around patient safety. And when Ebola came out, we understood that if a patient came into a facility with Ebola, the risk to the caregivers was really, really high, and it could kill them. And so we started a real focus when we talk about safety, not just about the patient, but about the employees. One, to be prepared to respond to the needs of the community, also because we wanted to take care of our employees. And so there was a huge focus on what do we need to do to make sure that our employees, physicians that are coming in contact with these patients with COVID, that we didn't know a whole lot about the disease at the time, were safe and wouldn't get COVID themselves and therefore then transmit it to their colleagues. So that was my first concern. As we started to get really busy, it started to really stress me in that, are we going to have enough beds to care for this community? We were hearing stories about New York not having enough beds, not having enough ventilators, and so supply chain became a huge focus. But I would tell you from the day one through today, the most important aspect of responding to the COVID crisis was caring for our people. And that meant understanding they were afraid, understanding that they were caring for patients that were dying in many cases, and maybe they hadn't cared for a patient that had died since they were in school. We had people caring for COVID patients that worked traditionally in ambulatory environments or in post-op recovery, and this was much different. So my number one focus was taking care of our employees and making sure we had the supplies to prevent them from getting sick, and being prepared to respond to whatever the community's needs were. You know, my leadership team's greatest responsibility to this community was to have enough resources to respond to wherever this thing took us. And that meant we had to have supplies, we had to have beds, we had to have facilities, we had to have people. And so our team's focus was on, let's make sure we do everything we can to ensure that we have resources to respond to this really unknown situation.
Yeah, the unknown territory. I can't imagine those first responders. I have a healthcare facility down in Florida, and we saw it firsthand as well. But to see people getting sick in front of you, dying in front of you, and to your point, maybe the first time they've ever witnessed that, but to understand that that sickness could impact them, yet they're still showing up every day, putting their lives on the line to save the community, right? It's a powerful thing when you think back at it, but at that time, everybody's just kind of moving full speed because it was new territory to all of us.
Yep.
So really, truly a wonderful testament to your staff, your leadership. But I think knowing you long enough that you would give it to your staff for being those heroes, right? Those people that showed up and said, I'm willing to put my life on the line to save other people. And truly remarkable. So let's talk about that a little bit. What are some of the tips that you gave to your employees to concentrate on their mental health, their mental well-being, knowing that it might mean longer hours, it might mean crazier days, the uncertainty in terms of how long this is going to last can't help you there. What were some of the tips?
I think you just hit on one of the things that was the most frustrating, and that was, we thought maybe we'd be out of this in 6 weeks.
Yeah.
And, most healthcare facilities, I would say all healthcare professionals, they can weather a storm.
Sure.
This was not a storm. This wasn't a hurricane. This wasn't a flood. This was years of an onslaught of an illness that was very communicable and had bad outcomes. One of the biggest responsibilities our team felt was, how do we create resiliency in our staff, not knowing when this was going to end. And, we understood, and as the tragedy and sort of the pandemic unfolded, you started to hear about mental health crises, both in the field, in hospitals and health facilities, and healthcare professionals, as well as outside. And so, being prepared to not only deal with the physical aspects of the disease, but the emotional and mental impact of COVID was something we had to gear up for. One of the things that we had in our pocket was we had a critical incident response team. We called it CERT. And we took it from fire and EMS and police, where when they would have a very bad event that created a lot of stress, a lot of emotion, a lot of fear, anger, anxiety for staff, they would bring in professionals for psychological first aid. Sure. We've had this in place for years, 24/7. We have 2 people on call that can respond to a crisis in the workforce. Could have been caused by something at somebody's home. I lost my child, came to work, my work team is all around me, we're falling apart. We want to be able to respond to the mental health needs of our employees. And so a lot of focus during the early and later days of COVID was making sure we didn't just talk about wearing your personal protection equipment to protect you from COVID, but we stayed really focused on watching out for each other. If you see something that you're concerned about, say something. If you think somebody needs a break, get them a break. Yeah. We talked about having mental health professionals available to support our team. Coincidentally, we opened our doubled the size of our behavioral health unit during COVID. It was underway, it was planned, but we actually opened up 20 additional behavioral health beds in the middle of COVID. Again, not because of COVID, but it certainly helped us.
Good timing for sure, yeah.
One of the things that I used to talk a lot about was there's a video that shows, it's about patient experience, and it's from the Cleveland Clinic. And it showed little bubbles over all of the patients that were walking around the hospital or visitors. And the bubble would indicate what's going on. I'm stressed out, I just lost my father, I lost my job. And what the video was intended to show was, to the workforce in healthcare, hey, you got to be conscious of what's going on in your patients and their visitors' minds. And I really bought into that. And I used to tell our staff, you need to leave your backpack of stuff that happens at home or outside the workforce in your car. And if we put stuff in your backpack at work, patient dies, you're having a little difficulty with your supervisor, you don't like your hours, you got to leave that in your backpack in the locker. You shouldn't be taking that stuff home. We didn't want to burden you with the work stuff at home. Yeah. And we were thinking, try and leave the home stuff. It's not realistic. Yeah. And it really hit me during COVID that I actually started to talk to our staff about, you can't leave your backpack in the car. Yeah. If you're homeschooling your kids, if you just lost your grandmother, if you've got a loved one that's sick, if you're afraid yourself, you can't leave that fear in the car. Yep. And it's naive to think that you can leave all of your experience in the workplace, in the locker, and not take it home. So we really amped up our focus on caring for the mental health of our employees. Yeah. It was a core responsibility and something we took very seriously. And we talked about it.
Yeah, it's an important part. That's the key right there, is talking about it. And I really think the stigma is being lifted. every day I think we make great strides in removing that stigma from the entire population of what it means to take care of your mental health. I think I heard you say before, and correct me if I'm wrong, that mental health should be treated like any other ailment.
Yeah,
disease.
and I was getting ready to go there. We don't think twice about calling somebody when we have chest pain.
Sure.
Or when we think we might have pulled a muscle. Right. But you're right, there is this stigma about the brain.
Yeah.
The brain is just another organ in the body, and maybe the one we know the least about.
Yep.
But why shouldn't people pick up the phone and call and say, hey, can you help me find a mental health professional to help me deal with stress? No differently than can you help me find a cardiologist to care for my heart? And I think we're getting there, but we're not there yet.
Yeah.
And the more people understand that the brain is just another organ in the body that needs care and attention like all the other parts of our body, until we get there, we're going to continue to have horrible circumstances that turn out to have bad outcomes.
Yeah, it's so true. Look, I'm not ashamed of saying that, I see a therapist now. I love it. It's actually one of my favorite things to look forward to. It's once a month. But I talked to my wife. She's like, "Oh, great! Today's your therapist day," and she gets all excited. But I'm not ashamed to say that, and not ashamed to say that I take a medication for my mental health, right? And it's helped. And I think 10 years ago, even 5 years ago, it'd be really hard for me to say that in this world. I think with the competitive nature of business and athletics and families and social cultures, it's. I'm glad to see that stigma being broken down. I'm glad to see more people who have bigger followings, who have big jobs, who have big presence in the community starting to talk about it, about how important that is. So thank you for listening.
Well, I'm right there with you.
Yeah.
I take some meds.
Yeah.
I see a therapist. And, I think about my 40 years of the role that I've been in, the roles I've been in, and the stress that comes with it. I'm not doing a service to my team members or my family if I'm not taking care of my mental health.
And
right. Quite frankly, you can make a case that it's every bit as important as your primary care doctor.
Oh, 100%. And that's the thing. I don't think people realize that you can't be a good dad, you can't be a good friend, you can't be a good husband or wife or whatever unless you yourself are mentally stable and
it
healthy.
Doesn't mean you're weak.
No.
It doesn't mean that you're not as good as the next guy. But even beyond that, whether there's genetic issues,
Sure.
whether there's workforce issues, whether there's family issues, we're in a complicated world.
We really are.
And, as leaders, we bear the responsibility of more than just our lives, ourselves. I think about my 13,000 employees all the time. Mm-hmm. And what can I do to make their environment as safe, as psychologically safe, as economically safe as possible. And that wears on you.
Yeah, yeah. And it's a balance too, Jack. Like being a leader who has to focus on the well-being of the patients, the well-being of the staff, and the well-being of the organization, right? Meaning economically, right? You have a fiduciary responsibility to the organization of making sure that it's balanced, and all those things are balanced.
And ultimately, the well-being of the community.
Yeah.
And if I start there, I can't do that if I don't do all the things you just said.
Yep. And therein it is the complication of it all. So,
but that gets us back to prevention.
Yeah.
If we can do things, and I would say that before the first light of COVID at Mainline Health and the impact that it was going to have on us, we had a really healthy culture.
Yeah.
And our employees knew we would be honest with them. Our employees knew that we would be transparent with them. Our employees knew that we would do what we could to care for them and that we would spend the money necessary to create a safe environment. So a lot of the things that you would have anxiety over in a crisis, we had a long track record of what they would expect.
Yeah.
We were predictable as leaders. The organization was predictable, and I think that weighed heavily in our ability to manage through the chaos.
We're starting to see more tools come out, more ways for people to understand about mental health on the prevention side and on the clinical care side. We talk about the ability to work from home and people returning to the office. Talk about mental health days. And you talk about a lot of the tools and modalities that we're offering people to understand. And not all the time, but sometimes you see people taking advantage of those. Do you have any insight to lend to how you balance that?
One, you're much more optimistic about the future of mental health
Yeah.
and mental health support than I am, because I still haven't seen the financial commitment to resources supporting mental health providers that I think ultimately we need. We have a shortage of mental health professionals in this country. And one of the reasons we do is their reimbursement is very difficult. And until there is appropriate financial support for mental health professionals, we're going to continue to have a shortage. We have a shortage of beds. I think as more and more people become aware of the benefits of seeking out mental health, the demand for mental health services is going to go up.
Yeah.
And we're going to need to have the supply of mental health professionals to be able to support them. And if reimbursement for those services is below what it costs, we're going to be in another problem.
Absolutely.
We talk a lot about work-life balance. And when you and I first started in our careers, and certainly when our parents were in their careers, that wasn't even a word. You didn't see 3 words, work-life balance. That was just not a concept. Some could argue we've taken it too far, but it is what it is. And the bottom line is that people want a life. And I think as employers and leaders, what we have a responsibility to do is to create an environment where people can have a work-life balance, where they don't feel like they're on call 24/7, 7 days a week. And that creates a challenge for leadership. I would argue that some of the working from home is creating some of the mental health problems.
Yeah.
That, we are putting people in isolated situations. I think that while I'm not an expert on social media, I think we've created a whole generation of people who aren't used to interacting with people face to face. I'll text them.
Yeah.
I'll email them. And we say and do things in text and emails that we would never say face to face.
So true.
And so we could have a whole discussion about what is social media doing to the demands for more mental health.
Yep.
So I hope you're right. I hope we're going to see a big surge in the availability of providers, a surge in the appropriate reimbursement for the care provided by those providers. But I've not seen our employees take advantage of us. In fact, I still think we've got people hunkered down, not willing to tell someone they're in a crisis.
Yeah. We have a company, Spirits, which is a behavioral health care prevention company. And Spirits' job is basically to provide very relevant mental health prevention content to organizations. And we've heard through the grapevine from some customers that they've gotten feedback of certain pieces of content that were very educational in nature to use to the employee benefit. So that's why I asked that question.
Yeah, I think it's true for everything, though.
Yeah.
I mean, what I think we got to be careful is we don't let the small number or small percentage of people that take advantage of something take away the program.
Agree.
And we can't lose sight of the fact that the majority of people are going to do the right thing.
Yep.
And us doing the right thing for the majority of people will ultimately allow us to do a better job at delivering on our mission.
I love that. I think that's one of the most important things that we've touched on today, right? Is no matter what topic we're talking about, there's always going to be a few people that don't do the right thing. But the majority of the people in the room, in the organization that we're talking about, are wired to do that right thing and want the best for the rest of the organization as well.
One of the things that we talked a lot about at Mainline Health was this whole creating an environment that reduces stress for the care providers. And some people will talk about massage chairs and quiet rooms. And what our physicians told us who are feeling this stress is we don't want that stuff. We want to fix the problem. And so when you think about prevention for mental health, often we're treating the symptoms as opposed to treating the cause. Mm-hmm. And one good example for us is when we think about the number of hours that we demand our caregivers and our physicians to work, spending time in the chart, in the medical record. A lot of them would tell us they were having to do it from home because it was inefficient and not helpful. And we've gone to ambient listening technology where a lot of that can be done real time, live, that assists that care provider in the documentation process. if I can take an hour out of that care provider's time that often always goes unreimbursed and often is on their personal time, I've reduced their stress.
Yeah.
So prevention, it's not just, let's put a Band-Aid on it. It's what caused the cut in the first place.
Yeah. Yeah, it's interesting that there's a lot that needs to change there, right? And again, that goes back to a whole different topic, but the entire ecosystem of folks, stakeholders of folks involved in healthcare, getting on the same page.
Well, and managers and supervisors are critical to that whole process.
Yeah.
We create stress and we can reduce stress.
Yeah.
And when stress comes upon managers and leaders, they tend to be the first to exhibit behavior that causes stress for the people below them. And so being conscious of how our interactions with people create mental health challenges is part of that prevention.
All right, we're going to take a pause and we're going to go to a quick fire segment here. A couple quick questions, Jack. And I like this because it opens up a little bit about our guest here, Jack Lynch. First thing you do in the morning, coffee, news, or something else?
No, I'm embarrassed to say I pick up my phone, I look at my emails, I look at my text messages, and I read the digital version of the Philadelphia Inquirer.
All right, that's great. One leadership principle you live by?
Integrity.
One thing every leader should stop doing today?
Blowing smoke.
Okay, that's a good one. Best piece of advice you've ever received about people?
They want to do the right thing.
One word that describes what leadership should feel like?
Transparent.
And last question. What's one small daily practice that helps you reset?
I think a lot about our product, healthcare, and who benefits from what we do, and that's the patient. And so whenever I'm in a meeting, whenever I'm thinking about the role our organization plays in the community, I go back to that single patient that walks through the door and expects us to take care of them and to meet their needs. And that's not making widgets, and there's nothing wrong with making widgets.
Sure.
But we affect people's lives every time somebody walks through that door. And that really focuses me on why the work that all of our team members do is so important, and why the work that I do to support them in being able to do their job is so important. It's pretty grounding.
No, that's great. If somebody listening is leading through chaos right now, right? Take you back 6-7 years ago, maybe in business, healthcare, or their own life, what's one mindset shift that could help them stay grounded today?
One of the things I've lived by for a long time, and I've done a pretty good job at it, but not great all the time, is explaining why. As leaders, we're expected to paint a picture of a vision and tied to our mission and move people in the direction that's going to get us to where we ultimately need to get to. And, I say a lot about leaders are not leaders if they don't have followers. And there's nothing wrong with being a follower. And the more leaders you have as the ultimate leader of the organization, the harder leading is. Because I say leading leaders can be challenging because they've got their own skills. But you're nothing without people following you. And what I found throughout my career is if you tell people why, they're more likely to do what you need to do to get the job done. Mm-hmm. And so particularly during COVID, when we were coming out with vaccine requirements, personal protective equipment requirements, staffing requirements, change in policies, we tried to explain why. Mm-hmm. Not just this edict came down from a high that says you have to do this. We'd say, this is why you have to do it.
Sure.
And I think that went a long way. So I would say, being transparent, explaining why, and empowering people.
Yeah.
I can't deliver care in this community by myself.
Yeah.
I can't make the impact that our 13,000 employees and 2,000 doctors can have.
Yeah.
And so empowering them to ultimately achieve the mission we're all about and giving them a sense of responsibility that they can make decisions. I think anytime you can empower your staff, you're going to be a better company.
Yeah, no, that's very powerful. It brings me back, Jack. I have 200 employees down in Florida, not 13,000, so much different scale. But there's a couple things we talked about today that you mentioned that resonated with me. Number one is this whole backpack theory, which I love. And it's funny, I give town hall meetings when I'm down in front of, a couple hundred people, like I said. But one of the things I always talked about was I understand how hard this job is because every day I ask you to check your problems at the door.
Right.
But one of the things that I learned today and I'm going to use is that it's virtually impossible.
Yeah.
And I love that. Thank you for that because it helps me understand, like, let's stop drawing this line of impossibility because that could create a little bit more fear in my staff's lives of saying, man, I'm expected to drop everything that I have going on and put a smile on my face and walk around here and not talk about it when it's virtually impossible.
Yeah, back to your earlier comments, it's a balancing act.
Yeah.
I mean, I think in hindsight, I was being disrespectful to our staff to expect that they could leave the stuff from home in the car.
Yeah.
It's just people don't work that way.
Yeah.
When you think about what environment we're in right now with the government shutdown, with the political challenges with one party versus another party, we've got all of those issues swirling around in our workforce. No doubt many of us have employees who have loved ones or partners who have been furloughed or who have been laid off or who are not receiving a paycheck and are expected to work. You can't leave that in the car. And when an employer and leaders in the company care about the stuff that's going on outside of work, it just says so much about the organization.
Yeah. No, thank you for that tip. That's fantastic. And I feel like there may be a lot of people out there that do that and operate that way, but maybe need to make it a little bit more clear to their employees.
We used to think it was the right thing. We used to, the patient's always right, the customer's always right, patients come first. They all do come first.
Yeah.
But we can't ignore the stuff that's going on. And when an employer takes the opportunity to provide emotional support and mental health support, we have a very strong employee assistance program that we can outsource our employees' needs to. That says something about your employer.
Yeah.
I think one of leaders' responsibilities is to try and retain your workforce. Yeah. And back to your whole point of prevention, if you care about your employees, if you show them you care, if you give them resources to deal with some of these physical and mental and emotional challenges that they face in their life, I think that will lead to employees staying longer with your organization.
Yeah. And that was our thought about developing spirits and quite honestly, was giving organizations more resources, but resources for the entire organization. A lot of the mental health solutions that have been out there have been for those folks who need acute crisis intervention or subacute, but pretty, more clinical focused intervention. There was a huge gap in the 75 to 85% of workforce and their families and their loved ones who are mentally healthy, but are thriving for resources to understand what mental health challenges they're thinking about or going through, or their kids are going through, or their friends are going through. And now, if you have a resource out there that people could look at their own leisure to understand that, oh, this thought that I'm having or this experience that I'm going through is normal, it paves a way for a lot more.
Yeah, it's so true. And I'm excited to hear about what you're doing because we had some small things inside the organization. In HR, we actually had lunch and learns around your resiliency muscle.
Yeah.
Who knew there was a resiliency
I
muscle?
didn't.
And we would have one of our internal trainers would get up and do a lunch and learn about how to exercise your resiliency muscle. And I'm thinking as a leader, and I actually went to the session, I'm thinking as a leader, how more important is that muscle in the work we're doing, particularly in a crisis?
Yeah.
The other thing I would say back to your point about, utilizing resources that are available, a lot of these programs are often available to managers and supervisors,
Yes.
or they're available to the executives or to the leaders. Every single employee in our workforce has different or the same challenges that cause them the same kinds of stress that any leader in the organization had. Tell a story. I was in the cafeteria one day with my general counsel in my last organization, And Milton Davis came out. Milton was our pastry chef. And I said, Milton, how you doing? He had his big chef hat on. And he said, Jack, I'm doing okay, but it's been a bad day. Just a lot of stress. And he went back to his job. And my general counsel, who was a former NFL player and a lawyer and thought he was one of the most important jobs in the organization, said, what kind of stress does Milton Davis have? I said, you don't understand. When Milton Davis burns the cookies, that's as bad for Milton as it is when you screw up a contract. Mm-hmm. And I think as a leader, having an understanding that while the roles and responsibilities may be different, the burden of the responsibility, the burden of the fear of failure is no different for any of our employees, whether you're a housekeeper, a patient registrar, a nurse, a physician, or a general counsel.
Yeah. And you know what? The circle of influence, too. Any resources that can be out there that are resources for every employee, but also their loved ones, is super powerful, too. Because the healthier somebody knows that their circle of influence is, the less stress and burden on them as well, and the better they're going to perform at their job. Well, this has been great. I have a couple really key takeaways from today's segment. I know our listeners will as well. Number one for me is the backpack theory, and I love that. I love the fact that I could see that the reason it was such a big theory for you at the time, but how you've unpacked that, for lack of a better term, and kind of understand that it's virtually impossible for somebody to really expect out of their employees. So thank you for that. Number two was, don't let a few people who are going to do the wrong thing in terms of utilizing resources ruin those resources for the rest of the organization that's going to do the right thing. Because I think you said it a couple times, is that most people want to do the right thing, right? And I think that every organization should take that away and provide those organizations with the right tools and support in order for those organizations to thrive. So,
but to your point, most people want to do the right thing, but they're looking for their leaders to demonstrate that they're doing the right thing.
Yeah.
And I think the whole conversation we've had around prevention and taking care of the workforce and being cognizant of the fact that the brain is just another organ in the body, a pretty critical organ in the body that we need to give as much attention to as we do to those other critical aspects of living life.
No, that's great, Jack. Well, thank you so much for joining us here today. I normally would say out of your busy schedule, but it sounds like you got a little bit more time.
I got a little more
time.
time.
You deserve, by the way.
I'm trying to perfect my golf game so I get on the course with a Holloway. But I really applaud you for the work you're doing. You're in a tough space, the substance use disorder space, the mental health space. There's an absolute need for it, and there's a need for us to do it in a very efficient way and a productive way, and do it in a way that expands beyond what we've done in the past. And it feels like the work you're leading is going to really help us do that.
Thank you so much, Jack. I appreciate it. And thank you for all you've done for our community.
Thank you.
Thank you for tuning in today on Prevention Pioneers. I hope you enjoyed the conversation today with Jack Lynch. If you did, please like and share on any platform of your choice. And please tune in to the next episode of Prevention Pioneers. Have a great day.